Thanks for tuning in to Health Advocates Ask the Expert series, our monthly show about trending topics in healthcare. I'm your host, Courtney Preiser. Today we're joined by Marcia Otto to discuss effective strategies to impact employee engagement. As Health Advocates Vice President of Product Strategy, Marcia helps develop solutions to both reduce healthcare costs and engage employees in their health. Thank you so much for being here.
Thanks for having me, Courtney.
So engagement is obviously a huge topic, and we can only scratch the surface. But just to kind of start with, what are some of the biggest struggles that organizations face trying to engage employees in their health?
There's a number of big hurdles, but I'll address two of them. The first one is awareness. Many employees aren't even aware of what benefits that they have. And according to a recent Health Advocates study, 41% of employees said their biggest complaint about their benefit package is that it's communicated too infrequently. The second hurdle is fragmented services. Employees have on average of 7 or more healthcare vendors that they deal with in their benefit package. So that's 7 logins, 7 phone numbers, communications coming from 7 sources. And it's very complicated, and it causes fatigue. It causes login fatigue, communication fatigue, and on the employer side, it causes administrative overload.
Overwhelming and confusing.
Very much.
Yes. So what are some strategies then that organizations can consider to help maximize engagement?
We've identified 5 strategies, and I'll go through those really quickly. So the first one is integration. As I mentioned, those 7 vendors out there. So many vendors are moving towards an integrated solution, or building a hub, a one-stop shop where all 7 of those are in one place with one phone number, coordinated communications to make it easier on the employee to gain access to those benefits. The second one is relevancy. How do you make it relevant for the employee to take actions to improve their health? And so you've got all that data from all those different programs within the platform. Take those to create really great proactive communications for the member to take actions. The third one is effortless. This is the easiest one. Make it easy to use.
Absolutely.
Make it easy to find so the member doesn't have to dig deep to get information they're looking for. The next one is make it smart. We talked about how to make it smart for the employee in terms of personalization, but for the employer, make it so that the employer can see how their programs are performing, to how they can tweak those and see how it's going on a real-time basis, and to improve the ROI for each program and the solution overall. And lastly, to make sure the solution is connected. Employees want to be, and studies show this, that employees want to be communicated in the way that they want to be communicated for each unique situation they have. So what does that mean? An employee who's in a disease management program likes to talk to a human with their actual questions.
Makes sense.
However, if even that same employee or another employee who's on a wellness program, they like to do all that stuff online or on their mobile app. So you just need to make sure that they can access it all, that you have something that you have the personal support, you have web and mobile, and then communications from all that.
Make it easy and give them options.
Exactly.
So what are some of the top technology trends that you're seeing in this space as organizations are trying to enhance their engagement?
So I see 2 major trends going on with technology. The first one is there's an app for that. According to the National Business Group on Health in February of 2017, there was over 156,000 health-related apps. Another study said 256,000. And then to keep throwing numbers at you, according to a Rock Health study survey this year, 85% of digital health startups are targeting employers for who they're selling the solutions to. So that's a lot of noise in the marketplace, all going for the same group to try to get revenues out of them. So along with that trend, there's a number of organizations out there, kind of a secondary part of the trend, that are building these integrated hubs, these one-stop shop digital platforms where they take all the different benefits, including advocacy, employee assistance, wellness, pricing transparency, nurse line, disease management, et cetera, et cetera, et cetera. All those into one platform, so there's one phone number again, one login, and all the communications and data from that using artificial intelligence and machine learning and/or to really target and create personalized messaging. So just all those together can really help improve employee engagement.
Customize it to them.
Customize it to them.
Yes. So what is the biggest takeaway that you would offer regarding employee engagement today?
Well, there's clearly a growing preference to use high tech for communicating health information to the employee. We're all using the web to check, symptoms, or do I have a horrible disease?
All the time.
However, when you really do know you have an issue, you want to talk to a person directly. And studies have shown, and I really like this one from United Health Consumer Sentiment Study, that 78% of people like to talk to an actual human when they have a specific health question. So you can make your solution all high tech, but you really, you're not going to be able to help everybody out. You need to
Right.
make sure when you're looking for a solution that you get this holistic solution that has the combination of high tech, high touch, high human touch. And then some of the other things I mentioned before, easy to use, using shared data to create better communications and to be able to communicate in the member that they want to be communicated with.
Makes a lot of sense. So how is Health Advocate utilizing some of these strategies, and what makes us unique in the marketplace today?
Well, Health Advocate has been around for 20 years, helping members navigate their healthcare, or helping employees navigate their healthcare, and been very successful at this. Health Advocate also has a digital presence, and so we have built out a hub, that one-stop shop that has all of our solutions on it. Plus, we can integrate with other third-party solutions as well to give the member one place, one phone number, like we always have had one phone number, but one place they could also go and do some self-service, or check the status of their cases, or to do some of their own searches. To get, and then to take all that data to do personalized messaging for them to help them take the next step. So we could connect them to experts, or for those who want to do self-service, they could do it on their own. But I really feel what Health Advocate is unique at and is going to be very successful is because we still have, and have had for 20 years, that personal human touch with experts, to be clear.
Absolutely. Good customer service, too.
Yes.
Well, this is great. Thank you so much for being here.
Thank you.
And thank you for tuning in. If you like what you just heard, you can follow us on our social media pages below, and we hope to see you again next time for another edition of Ask the Experts.